Okay. Okay, I think people are still getting in into the webinar session. Good morning, Vijay. Okay. Okay. So more people are coming in. Okay, I think Okay, I think Hema is typing something. Let me have a quick look. Hema, these are not actually. I do understand it's unfortunate that you have missed the classes, however, these webinar sessions are not actually recorded onto or put onto the IRS website. I can check with the team at IRS whether they would be doing that or not. I can find that out for you. Just a minute, please. So let me just quickly do that. Okay, Hema, with regards to your question whether the webinar sessions which has been conducted, whether it would be uploaded to the website or not, I did check with that, and it's been said that yes, it would be uploaded onto our website. So you can do that. You can even check those videos and try to understand that. But the videos does not help you. You need to do a lot of practice with the different materials so that you all can attain, good scores when you are doing your exams. It would be actually uploaded in the IRS Group YouTube channel. Okay, so you can go on to the IRS Group YouTube channel and find those details or the webinar sessions which has been done. Okay, so you can definitely get that from the YouTube channel. Okay, IRS YouTube channel. So all these webinars which we have been conducted, the sessions which I've done, you can definitely view that. People who have missed to get those or to attend those webinar sessions could definitely make use of those IRS YouTube channel sessions. So it would really help you to practice with the right skills and the right techniques for your listening or speaking. Okay, so I think we have quite a few attendees coming in today. So shall we start with the class? Oh, yes. Okay. So we would start with the classes. So as we have stopped yesterday, we stopped at by doing part B. So we would continue with part B. We have another three more questions so that you could get a hang of how to do. So it's just a quick practice session as well for you to see whether you are able to do the part B session. Okay, so let's quickly look into the part B sessions. So I would share you with um, the questions. Okay, I have shared this for you. Okay, now could you all please check if you are able to view the content or the questionnaires, or do you require that to be, uh, you know, zoomed so that you could see, or would this help you? Okay, so I will do the zooming. Okay, I hope this is clear to you all. Okay, okay. So yes, I hope everybody is quite clear with the questionnaire. Okay, let's quickly play the audio. So I would just like to take a quick recap. Um, but yes, I could do that for you. Okay, so let's concentrate on question number 28. Okay, I think this makes you more clear. Okay, so let's take a quick recap on the B part questionnaires and how and what are the skills which you're going to use while you are doing your part B. Okay, as we have discussed yesterday, we categorize the questions in simple terms as direct questions and indirect questions. Okay, so we all know that in part B, what you're going to do is just understanding just and answering the question. Yeah, so that is what you are doing through part B. Okay, in part B, as we said, there are two type of questions, that is direct question and an indirect question. So the direct question you approach in a way that, okay, the answer to the question would be there in a sentence. Okay, so when they are doing their speech, it would be there in one sentence, but it would not be there in the form of the same words or the synonyms. All you have to do is, like, from that particular sentence, you have to understand the gist of that sentence so that you get the answer correctly. But in the case of an indirect question or a statement question, the answers are normally got from a different statements or different sentences within that audio. Okay, so you need to find that, and from the two or three sentences or the words which they have said, you need to get the gist of that. So that's how you get the answer to that particular or indirect question. Okay, so we would, with that in your mind, you would we would do the questionnaires. That is question number 28, 29, and 30. Okay, we would do it in one go. So I would play the audio for you, and you can definitely, see or answer the questions. That is, we would do the first one, that is 28, and I would give you the time to do the 29th question. Okay, so let's quickly do it. Let me open up the audio for you. Okay, while doing the audio, okay, the audio is just opening up. I know that you are unable to see the shared window, that is the questionnaire. Don't worry, let me just get you the audios correct. Okay, so I'm going to play the audio, and you would soon see the shared questionnaire as well. Just give me a minute.
Question 28. You hear two hospital nurses discussing the assessment of a patient on their ward. Now read the question.
The bed manager just rang. He wants us to clear 3 spaces in the ward today.
Oh, it's never ending. Let's see what we can do. There's no one ready to be discharged, but we could try chasing referrals for Mr. Davison to the community hospital for rehab. Where are his notes?
Yes, but has he had his assessment yet?
They were all away at that conference yesterday and the day before. I think he'll have slipped through the net.
But Dr. Ahmad's already got him medically stable and signed off, so he should be the next one to move on.
Well, I'd get him there as quickly as possible before they give the place to somebody else.
I'll phone them straight away.
Question 29.
Okay, do we have the answer? Okay. Okay, do you see different answers? B, A. Okay. 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 So, okay. It's all A. Okay. Okay, let's look at the question, once again. Let's look at the question. The question, it states, there are two, you hear two hospital nurses discussing the assessment of a patient on their ward, okay? So, listen to the first statement itself. You hear two hospital nurses discussing the assessment of a patient on their ward. What is the problem? Okay, so are we looking at the hospital ward incompletely, or are we looking at the particular patient? Yeah, so we are looking at the particular patient and what is the problem, correct? So in that context, so you need to clearly understand the question. Yes, the patient. Yes. So in that case, what should be the answer? So most of you said the answer was A. So let's look at the patient's documentation has been sent to the wrong place. Was that right? Was that a problem? G, I think you need to look at the reception of your. How about the others? Are you all able to hear me clearly, or is there some sort of disturbance? Okay, yes. Okay, I think yes, I'm quite audible. Okay, good. So, Vijay, I think you please check with your connection. Okay, yeah. Okay, fine. Okay, so looking at the different options, different answers. Okay, here, look at the answers. Or the options. The patient's documentation has been sent to the wrong place. Nobody has taken the responsibility for assessing the patient. The duty doctor was unable to locate the patient. So the third one is absolutely we can, eliminate. The only things which are being said or which can be considered is the first one: the patient's documentation has been sent to the wrong place. I don't see that there is a statement which has been made, or from the statement, there was nothing as such whether the document was sent to a wrong place or not. Okay, so here it was the patient. It was said that in that particular context, that, or in that audio, that all the doctors and the medical professionals went for some conference, and and they even used a slang there. Okay, or on an idiom. Maybe he have clicked through the net. Okay, or left through the net or something as such. So that actually indicates that nobody was there to assess this particular patient. Okay, so nobody has taken, because they have all forgotten about, or they might have completely missed the patient. So that was what the understanding from this. So that is why, okay, it is we take the answer as a B. Okay, have you all understood why the answer has been taken as B? Okay, it was a direct question, and we got that through from that particular statement, that all of them, before the statement of all of them went for the conference, and before that it stated that he has missed through the nets. So that is what that particular sentence is where we get the understanding of the patient. Nobody has taken the responsibility to look after the patient or assess the patient, okay, before they came in, so that they could create some bed space. I hope everybody is clear with that answer. So the answer is B. Do you have any questions with regards to question number 28? Okay. So whomsoever has got the wrong answers, I hope everybody is clear with the answer which we have discussed right now. Oh, sure. Oh, if you would like, I could just even play that for you. Just give me a quick minute. Okay, I want all of you to listen to that audio again.
The bed manager just rang. He wants us to clear 3 spaces in the ward today.
Oh, it's never ending. Let's see what we can do. There's no one ready to be discharged, but we could try chasing referrals for Mr. Davison to the community hospital for rehab. Where are his notes?
Yes, but has he had his assessment yet?
They were all away at that conference yesterday and the day before. I think he'll have slipped through the net.
But Dr. Ahmad's already got him medically stable and signed up.
I hope you all got that particular, idiom, weapon. Slip through the net, yes. That's right. So this is what gives the understanding, or this is where we try to understand, or we try to get the gist of that particular conversation, and we get to the answer of, as I said, part B as the answer. Okay, I hope everybody is very clear about it. Okay, okay. So can we go to the question number 29? Okay, I do have Anjana. I got it. So, if you do have any questions, please please come up with the questions. Absolutely no problems. I can delay the time going into the next question. Absolutely fine. Okay. So I presume none of you have any sort of questions for me pertaining this the question number 28. Okay. So let's move on to question number 29. Okay.
And signed off, so he should be the next one to move on.
Well, I'd get him there as quickly as possible before they give the place to somebody else.
I'll phone them straight away.
Question 29. You hear the beginning of a training session for dental students. Now read the question.
This is session number 4, which is going to include, again, impression taking. We've created the crown impression of tooth number 30. We also took care of an inlay preparation. So today, we're going to stay on that side with our impression taking. We're going to make a duplicate of what we've already done, and our attention to detail is now going up another notch. When I take an impression of a tooth that I've created in the mouth, I naturally have to take care of the saliva, the blood, the gum tissue. We're not going to cover all that today. You'll hit that next semester. What we are going to cover are the dynamics of your impression, the margins, the proximal contacts, the bite, and the occlusion. We're going to capture all that in one impression.
Question.
Okay. So can we have the answers? We have C, B, B, C, B, B. Okay. B. Okay. B, 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 B. Okay. Okay. So let's look at the answer. So first of all, what type of question is it? It's actually indirect question. Okay. So it's not a direct question. So the options which we have is focus on aspects of dental hygiene. Definitely not. It doesn't state much about the hygiene. Expand upon what they studied previously. Keep that there. Introduce them to a completely new technique. So it was nothing new to them. It was actually the one which was being talked about the earlier days. Okay, that's how the conversation even starts. Okay. So, and it also stated that she is going to expand. She's going to take them through, or to expand on what she, taught them last days. Yes. Can't see the question. Okay. Wait a minute. Okay. I hope now you all can see the question. Okay. In this scenario, the thing is, what they have asked, what the doctor, the dentist said is that she just briefed or, recapped about what happened last day or the previous sessions. Yes. And she said, today we are going to do this. So it was actually an, expansion or a continuation of what I would say it's an expansion, not a continuation. It was an expansion of what they've been discussing on the previous day. Okay, so that is why we have the answer here. So we don't get that from the first statement. It's a combination of different statements. Okay, so we don't get that statement from one single sentence. We need to combine the first sentence and the second sentences together. So then from that we get the answer to be. So we need to really focus and do this, constantaneously. You need to practice this type of analyzing to get the answers correct. So I hope the people who have got the answer wrong, the answer to this is B. Okay, the right answer to the question is B. Expand upon what they studied previously. Okay, so I hope everybody is clear with it, with the with this particular question. Okay, clear. Okay, so this is how you approach the Part B question. So this is the basic thing. I'm not saying, total 100%, you would be able to get the answers by this sort of way, but I can guarantee you one thing, 90%. Okay, 90%, the questions are, you can get the answers to the questions in this particular way. There are certain questions, but on this particular questionnaires, I don't have that a type of question arising. But it's what I've seen is like, we don't get much of those type of questions. Even if it's a direct question, you might have to find the answers from two different sentence or statements. Okay, so but it's not that often you get that type of question. So it keeps on changing. Maybe one of the rare cases you might come up with that. Okay, so I hope till now you are all clear with part B. We also, I hope everybody is clear with the part B. Okay. So we would go with the last question of part B, that is question number 30. Okay, so let me pull that down for you. Okay, so question number 30 is a direct question. So I hope everybody gets it right. Most of the times people make the direct questions right, but you miss on the indirect questions. So if you also see, OET comes up with indirect questions most frequently than the direct questions. You hardly get direct questions in the exams. For example, most of the times it's indirect questions. Okay, so please be sure about that. Okay, so this is a direct question. So try to get this one right for everyone. So let me quickly play the audio. Just give me a minute.
Question 30. You hear two nurses discussing the treatment of a patient with a kidney infection. Now read the question.
I can't see the results of Mr. Roberts' last blood test to check creatinine levels. Did you do the last one?
No, not me. Let's see. Here it is. The last test was 4 hours ago and results show a level of 38, so it's still well below normal. We better do one when he wakes up, as it might have changed. The patient's not keen on needles, though. I had a real job last night trying to convince him it was necessary. Not the easiest of patients, if you're happy to have a go.
Okay, my turn, I reckon.
Okay, I hope you got the answer to the question. Do you want me to? Okay, I'll just show you the question again. So can we have the answers to the question? Okay, what we have here is we have all the options being displayed. Okay, we have A, C, then we have A, B, C, B, A, C, 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 B, A. Okay. Okay, do you all want to listen to the audio once again? Okay, first of all, read the question very correctly. Okay, here you hear, okay, I hope you can all see can you all see the questions? Okay, so let's look at the question let's observe it once again. You hear two nurses discussing the treatment of a patient with a kidney infection. Okay, so what is a female nurse doing? Okay, what is a female nurse doing? That is the question, not the male nurse. The question is, what is a female nurse doing? Okay, okay. I think right now you should be getting the answer. The options are emphasizing the urgency of a procedure. Was she doing that? Suggesting how to overcome a difficulty. Okay, warning him about a possible problem. Okay, so let's hear the audio again. Okay, here we go.
Question 30. You hear two nurses discussing the treatment of a patient with a kidney infection. Now read the question.
I can't see the results of Mr. Roberts' last blood test to check creatinine levels. Did you do the last one?
No, not me. Let's see. Here it is. The last test was 4 hours ago and results show a level of 38, so it's still well below normal. We better do one when he wakes up, as it might have changed. The patient's not keen on needles, though. I had a real job last night trying to convince him it was necessary. Not the easiest of patients, if you're happy to have a go.
Okay, my turn, I reckon.
Okay. So we have C, 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 B, C. C. Yeah, what is the problem? Yeah. See, the question itself, what is the problem, right? So the nurse, okay, the female nurse, what she did is she said that he has a problem with the usage of needles. So the problem was illustrated there, okay, and actually it has been warned Okay, there is a possible problem. So the female nurse is actually telling the male nurse that, if you're going to use a needle or some sort of, for example, to take the blood test, definitely you have to use a needle. Okay, so the possibility is that she is actually warning him, okay, about the possible problem. So he's not. Did she suggest anything to overcome a difficulty? Okay, so first of all, A wasn't there at all, emphasizing the urgency of a procedure. That is absolutely done. B and C is something which is there. So suggesting to overcome a difficulty, was she giving any sort of an idea to them about overcoming that situation? No, she was just telling that there is a problem. So please be. She's actually warning him that there will be a problem. Is that right? Correct? Okay. So have we got how we got the answer? So all you have to do is don't think too much. Okay, when it's a direct question, think normally. Okay, you don't have to break your head basically. Okay, think when you overthink, actually you intend to have more options, and you intend to make mistakes. Don't overthink, just think as a normal person. Okay, it is very easy. So if you practice this way, maybe because you weren't using the same technique while you're doing your listening part, so there could be a possibility or a probability that you intend to make mistakes. So nothing to worry. It takes time, okay, to practice a new technique or a new way of doing things. But do you think that, okay, this technique is going to help you? If you are not confident, I wouldn't recommend to use it. See, to attain a technique or a skill, basically you need to have practice. Okay, if you are convinced with this technique, please use it. If not, you can go, with the same technique which you used to use before. So if you were able to get it, fine. Because what I feel is that if you are able to apply this skill and this technique, you would be able to attain at least 95% answers. Okay, so do you think this is good for you? And to the answer to this question is C. Okay. Okay. So the answer, all you need to do is do practice. Practice was different. In a day you can't acquire a skill. It takes time and practice. Okay, do it frequently. Do the listening frequently, and also don't forget another thing. You need to familiarize with different accents. So to get a better understanding, you need to get familiarized with that. Normally what we do is, like, when we listen to different accents, we would normally focus on the way they speak, the accent, and things like that. So our concentration level moves on from the understanding the context to the consideration of accent. We will listen to the accent, so we get used to the accent. That is what you have to do. Okay, listen to different audios, different podcasts, different things. Get used to it first. That should be a first step towards listening. Listen to it, get used to it, and practice. Then you practice the skills. Okay, the skills and techniques to attain or to get the answers. Okay, so I hope everybody is clear with part B. Do you have any sort of questions? Anybody has any sort of questions? No, Vipin. Okay, clear, Sunita. Okay, I hope none of you have any sort of questions. I see that some of you are quite scared to ask questions, but don't be scared. I'm not going to do anything at all to you. So please feel free. Don't be shy enough. Also, you're actually losing your chances by shying yourself or getting that scared from asking questions. Do not worry, what is going to happen, nothing. All you have to do is like, you can clear your doubt. If you still have doubts pertaining to, any sort, it might be a very simple thing. It's absolutely fine. You ask that question, absolutely fine. Don't be scared. When you get a chance, use it appropriately and use it efficiently. Okay. So don't be scared for that purpose. Do it wisely. Okay. Yeah. Okay. So with that, can we move on to part C? Okay. Okay. So we will move on to part C. But when we are doing part C, okay, let me share the screen for you. Okay. When we're doing part C, I think you need to really stress your eyes. Okay. Because the audio goes on. I can't stop in between, so the audio goes on and on. So all the we have a total of 6 questions in each extract. There are 2 extracts in total. Okay, so basically we need to have this page displayed out there. So you need to really focus on the question and the answers within that 2 page. And again, the thing is here. So we have 6 questions each in each extract. So we have 2 extracts, which is having 6 questions each. Okay. So how do we go about? And each question can takes in each mark. Okay, there is no negative marking as such. So let's look at the questions and what are the techniques which are going to apply when you do the part C. Okay, so part C is all about hearing the extract. Okay, you will have the answers within the extract. Okay, all you have to do is pick the answers. Okay, so how are these answers mentioned in the extract? Okay, so that is the question. In part B, what you did was you listened to the audio, you tried to get the gist of the audio. Okay, so the words or sentence or any sort of things wasn't there. So you were trying to understand from the audio what is the answer. But in this case, in the case of C, it is not like that. So using the correct skill is what is very relevant here. In part C, what you're going to do is you're going to listen to the audio. You will have the words or the synonyms which is being used in part C. Okay, from that okay, Sandra, are you able to hear me clearly like right now? Can you check? Okay, so in part C, as I said, what you're going to do is that you're not going to do any understanding. You're not going to get the gist of what has been said. No. Okay, that is not the skill which you require when you are doing a part C. All you have to do is that to look for synonyms or similar words or the same words within that audio, and then get to the answer. Okay, compare it with, you don't have to derive any answer. Okay, the answer is already there in the audio. Okay, you only have to pick the answer by identifying similar words or similar sentences. Okay, are you able to understand what I'm just saying right now? Did you get the context or the concept of how to apply or how to get the answers for part C? Yes, okay. So here also we have the same type of questions as in we have in part B. We have direct questions, we have indirect questions or statements. Okay, so here also we apply the same technique. For a direct question, the answer to the question will be in one particular sentence, in maybe in similar words or similar words. Okay, so you need to pick that up. Clear? Okay, so these answers will be in the form of synonyms. Okay. Okay, yes, definitely I could do that. I could zoom in. So please let me know if it is okay. If you want to be zoomed more, I can do that. Can you all see this? Sorry. Okay. Because if I assume so, I doubt that you would be able to, you will not be able to see the entire question. How about this preview? Oh, 1 second. Will this look okay for you all? Can you all at least view this? We have a slight difficulty with regards to Part C because when I play the questions or when I play the extract, the audio is a continuous audio for each extract, right? So the problem is that if I try to indicate with the questions, that actually would help you, or with regards answering the questions. We will look at the questions one by one. That's absolutely no problems. Okay, but what I want you to do is to understand the question, or I want you to do the entire extract one, and we would see the answer. Okay, so first of all, when you do the extract or part C, please make sure that you identify the direct question and indirect question and look at the for the answers in that way. Okay, is that clear? Yeah. Okay, so let's look at the first question then. Okay, so let me play the audio for you. We would look at the questions one by one. So for the initial stage, so we can do let's say 3 questions, okay, one by one. Then we would look into another 3 questions, and the rest of the questions you can do it by yourself and see if you are able to apply the skills and techniques. Okay. Yeah. Okay, so let's look at the question. So can you hear anything? Do you hear? No.
Of end-of-life care
Okay.
for people with dementia. You now have 90 seconds to read of their work. For questions 31 to 42, choose the answer.
Wakes up as it might have changed. The patient's not keen on needles, though. I had a real job last night trying to convince him it was necessary. Not the easiest of patients, if you're happy to have a go.
Okay, my turn, I reckon.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a geriatrician called Dr. Claire Cox giving a presentation on the subject of end-of-life care for people with dementia. You now have 90 seconds to read questions 31 to 36.
My name's Dr. Claire Cox. I'm a geriatrician specialising in palliative care. My topic today is an increasingly important issue: end-of-life care for dementia patients. The care of dementia patients presents certain problems. Dementia is a terminal illness and is the third highest cause of death in Australia. But dementia is different from other such conditions. It has an unpredictable trajectory, and there can be difficult issues around patients' mental capacity, decision-making and communication. But, in spite of an equal need for palliative care services, dementia patients don't always fit the traditional model of such care. Families often suffer distress because they feel unable to ensure that their loved ones' wishes are being respected.
Okay, so are you able to get the answers? Answer to question number one, that is 31. Okay, B. Okay. Okay, absolutely right. Yes. So, how did you reach to this particular answer? The reason, or you just looked at the synonyms, right? So, the conditions can develop in a number of different ways. In the first sentence itself, she stated, the doctor or the Dr. Cox stated that there are certain problems. Yes, certain problems. Yes, which can have, dementia patients has certain problems. Their conditions can develop in a number of different ways. So that is like a synonym which we see, or it's the same words or the different, it's actually paraphrased in a different way. Okay, so you have the answer there. All you have to do is pick them up. You don't have to do your judgment or out there. Okay, so this is how you get the answer. Okay, so can we continue with until question number 33? Can we all do that? Or maybe the entire questionnaires, and we would discuss about it. Maybe the entire 36 questions. Okay. And see if you are all applying the same skills and techniques, and see whether we are able to get the answers. Okay. Yeah. So let me just quickly play that. I'll play it from the beginning, so it will be more easy for you. Okay.
My name's Dr. Claire Cox. I'm a geriatrician specialising in palliative care. My topic today is an increasingly important issue: end-of-life care for dementia patients. The care of dementia patients presents certain problems. Dementia is a terminal illness and is the third highest cause of death in Australia. But dementia is different from other such conditions. It has an unpredictable trajectory, and there can be difficult issues around patients' mental capacity, decision-making and communication. But, in spite of an equal need for palliative care services, dementia patients don't always fit the traditional model of such care. Families often suffer distress because they feel unable to ensure that their loved ones' wishes are being respected, or just don't know what that person wanted because the discussion wasn't held early enough. There is therefore a clear need for well-funded, patient-centred palliative dementia care that's available when and where it's needed. I do a lot of work with Dementia Australia, an organisation which represents the needs of Australians living with all types of dementia, and of their families and carers. It also campaigns on dementia issues and funds research. Dementia Australia decided it was the right time to examine the issue of end-of-life dementia care from the perspective of the consumer as well as from that of the healthcare professional. It's a timely initiative. We have plenty of anecdotal evidence but not enough hard facts about what's going wrong and why the system's failing. But the current situation isn't all bad. Despite the issues I've mentioned, I've heard some wonderful examples of how palliative care has made a big difference to people's lives. Things can obviously go badly wrong if this isn't handled well. But in the right circumstances, people with dementia can reach the end of their lives peacefully and with dignity. Dementia Australia commissioned researchers to conduct a survey on the end-of-life issues affecting dementia patients. The survey covered both care professionals, that's doctors, nurses and others working with dementia patients, as well as family member carers. The interest was overwhelming, with more than 1,000 responses from around Australia. But what do the results tell us? Well, the initial results confirmed what we've heard about access to appropriate end-of-life care. It was obvious immediately that there was a striking gap between the perceptions of care professionals and family member carers about end-of-life dementia care. For instance, while 58% of family member carers said that they didn't have access to palliative care specialists and 68% didn't have access to hospices, 3/4 of care professionals indicated that people with dementia in their area do in fact have access to palliative care. This begs the question of whether consumers, that is, patients and family member carers, might not be aware of services that are available. Another notable finding of the survey was that care professionals often lack knowledge of the legal issues surrounding end-of-life care. Some reports indicate that care professionals are at times reluctant to use pain medications, such as morphine, because of concerns about hastening a patient's death. However, access to appropriate pain relief is considered to be a fundamental human right, even if death is earlier as a secondary effect of medication. Our survey found that 27% of care professionals were unsure about this, or didn't believe that patients are legally entitled to adequate pain control, if it might hasten death. So perhaps it isn't surprising then that 1/4 of former family member carers felt that pain wasn't adequately managed in end-of-life care. This lack of awareness extends beyond pain management. The statistics on refusing treatment were particularly shocking. Almost 1/3 of care professionals were unaware that people have the right to refuse food and hydration, and 1 in 10 also thought refusal of antibiotics wasn't an option for patients in end-of-life care. How can we ever achieve consumer empowerment and consumer-directed care if the professionals are so ill-informed? There's a clear need for greater information and training on patients' rights. Yet over 1/3 of care professionals said they hadn't received any such training at all. It's obvious that end-of-life care planning is desirable. Discussing and documenting preferences is clearly the best way of minimising the burden of decision-making on carers and ensuring patients' wishes are respected. Advanced care planning is essentially an insurance policy that helps to protect our patients in case they lose their decision-making capacity. Even though a patient might believe that loved ones will have their best interests at heart, the evidence shows that such people aren't that good at knowing what decisions those they love would make on complex matters such as infection control and hydration. So before I go on to...
Okay, everyone, were you able to get the answers? Yes, could you give the answers for the same? Or we would discuss one by one then, yeah? Okay, let's look at the first answer, that is question number 31. Okay, the question number 31, the right answer is B. Yes, that's right. So I will just dictate the answers because that would be more convenient for you all. Okay, so that is 32. Answer is A. 33 is B. 34 is C. 35 is A, and 36 is B. So I would put the answers in the sequence. That is 31 is B, 32 is A, 3 is B. Okay, here are the answers. So please check if you were able to get all the 6 right. Okay. So what I'm predicting is at least 3 in C for all of you. So if you could tell me, how many correct have you got? BG is 4. Okay. Okay. Jana 3. Yes, good. 3. Yep. 2, 4. Okay. 3. Okay. 3. Okay. Fine. So for a start, definitely it is a good start. 3, 4, and things like that. It's absolutely fine. So I think that most of you are doing good with regards to the question. So it is just that you require more practice on these sessions or the listening for part C. I hope most of you people, most of the candidates find part C as a bit of a difficult portion compared to part A and B. Okay, so not to worry. With practice, things would turn up good. So all you have to do, as I just said, use these techniques, okay, to do part C. That is, identify the questions as a direct question and indirect questions. And when you're looking at those questions, okay, one by one, have it that in your mind that whether it's a direct question or an indirect question. So you know where to look and what to look at. If you don't know what to look at, how do we get the answer? Yes. So, for example, when you play hide and seek, okay, if you are given with some, most of you might have played this hide and seek game in your childhood. So, when you see or when you're asked to find an object, okay, unless and until you are being described about it, okay, you know what to be searched, it will be quite difficult for you. So first thing is that you need to understand what you have to search for. Okay, that is what we are identifying from the questions like direct question and indirect question. So we know what to be looked for. Okay, so that is what you should be doing. So you need to basically understand what are you searching for. So you're just searching in the blank doesn't give you any sort of, the more clues you get, the more easy it would be to get the answers. Okay, but it takes time, okay, to analyze or to do the search. Okay, so it takes time. With experience, it comes with you. Okay, it will become more easier to you. Okay, so do this, practice this, and you need to find out, okay, when each time when you go through it, okay, what you have to do is you need to find if you where are you lacking in? Are you lacking at direct questions or are you lacking at indirect questions? So you need to find, and maybe you can practice that more often, okay, whichever it is. Okay, so some of you might be good with direct questions, some of you might be weak in indirect questions. So practice that more. So you identify what is your exact weakness or problem. Then you treat that. That is what normally most of the medical professions do, right? They look at what is the real problem and they treat accordingly. So that is what you also have to do. Okay, so do this on a frequent basis, like listen to different audios or listening audios, and try to apply these techniques and skills while you're doing it. Okay. I will discuss a few questions, not incomplete, complete, questions. We will take a question, indirect question. We did a direct question in the beginning, so we will do an indirect question as well. So let's look at the question number 33. Okay. Okay, let's look at the question number 33. Okay, are you all able to see the question number 33? Yeah. Okay, so let's look at that particular question. So the question, let's first read what is a question, okay? So for Dr. Cox, the initial results of the Dementia survey reveals that palliative care, it's an indirect question, right? Okay, and here, let's quickly also listen to the audio. Okay, so let's find where the answer is. The answer is basically, as we have discussed, it was B, was more widely available than some users imagined. Okay, with this perspective, can you see or can you try to find the synonyms or the similar words in this particular audio? Okay, just see that. I want you to do by yourself and see if you can find that. So
with all types of dementia. And third highest cause of death in Australia. But dementia is different from other such conditions. It has an unpredictable trajectory, and there can be difficult issues around patients' mental capacity, decision-making and communication. But, in spite of an equal need for palliative care services, dementia patients don't always fit the traditional model of such care. Families often suffer distress because they feel unable to ensure that their loved one's wishes are being respected, or just don't know what that person wanted because the discussion wasn't held early enough. There is therefore a clear need for well-funded, patient-centred palliative dementia care that's available when and where it's needed. I do a lot of work with Dementia Australia, an organisation which represents the needs of Australians living with all types of dementia, and of their families and carers. It also campaigns on dementia issues and funds research. Dementia Australia decided it was the right time to examine the issue of end-of-life dementia care from the perspective of the consumer as well as from that of the healthcare professional. It's a timely initiative. We have plenty of anecdotal evidence, but not enough hard facts about what's going wrong and why the system's failing. But the current situation isn't all bad. Despite the issues I've mentioned, I've heard some wonderful examples of how palliative care has made a big difference to people's lives. Things can obviously go badly wrong if this isn't handled well. But in the right circumstances, people with dementia can reach the end of their lives peacefully and with dignity. Dementia Australia commissioned researchers to conduct a survey on the end-of-life issues affecting dementia patients. The survey covered both care professionals, that's doctors, nurses and others working with dementia patients, as well as family member carers. The interest was overwhelming, with more than 1,000 responses from around Australia. But what do the results tell us? Well, the initial results confirmed what we've heard about access to appropriate end-of-life care. It was obvious immediately that there was a striking gap between the perceptions of care professionals and family member carers about end-of-life dementia.
I hope you all got to the answer of how do we get the answer to question number 33. Yeah. So were you able to find the similar words or synonyms when they do their speaking? Yeah. Yes. So that is what, okay? That's right. So this is how we find different, similar words. So this is where you find it, okay? You get similar words or similar meanings, things like that. So you don't have to actually, work out your mind to find an answer from the list or from the context. All you have to do is search it or pick the answers from the, the conversation or the extract, okay? So this is how you do a part C. I hope everybody is quite clear about this. Do you have any sort of questions pertaining to part C? Sir, got some ideas to find answers? Okay, see, I gave you a trick and a tip to do that. So I think you need to practice that more often. So this is actually a trick and a skill which you need to use. So there is no easy ways to find it, but unless and until you attain a skill or a technique, we can't say that. So in a day, you can't acquire the skill or the technique for any particular thing. Okay, it takes time, it takes practice. So all you have to do is you have to do a lot of practice with regards to your listening. Okay, that is what you have to do. Yes, need more practice. Yes, I would definitely do that, but I think I have to wind up for the day because I am short of sort of backup power. So at any time I might go offline. Okay, so I have some restrictions today to my webinar session. So, however, all I would like to request you is to do your practice with the same. I hope I could continue with this webinar session maybe tomorrow because unfortunately, due to say the circumstances which I am having today, I wouldn't be able to continue with the webinar sessions with you and to do further practice. I wish I could do that, but yeah, that's right. That's absolutely right, and the backup power is quite less. I was on back power from the morning, and I wouldn't be able to sustain that long. Okay, so I hope today's session was quite beneficial to you. So okay, so we would do more practices on listening. Maybe tomorrow we could do the continuation of the same, and maybe I could not the continuation. I think I have given you the ideas about how to do it. All we need to do is to do a practice on a session. Maybe I can come up with the second extract tomorrow, and we could do the practice session, okay, for tomorrow, and you can all the same, okay. So please just don't rely on just this webinar sessions. Just you do your practice, you try to acquire skills, and try to get it as much as you can, okay. So thank you very much, everyone, for having the patience to listen to me, and I really appreciate you understanding the concern as we have today here. Okay, so I hopefully look forward to see you tomorrow as well. Okay, thank you very much, and you all have a nice day ahead, and stay safe at home. Okay, thank you.